here today with Shelly Haggerty, the nurse manager of the operating room at Palomar Medical Center Escondido. So we're going to talk a little bit today about operating room and what patients go through and why they should feel safe. What surgeries are being done now that it's able to resume?
You may have had an elective case scheduled in March, and maybe what was elective in March is not so elective in May. You know, your disease has progressed or your pain has gotten worse, and that's really what essential means, that you can't really wait any longer.
So if I were a patient, how would I know whether I'm approved for surgery or not?
The first thing you should always do is go and have a chat with your doctor. It's time to go back to that physician you had met with prior to COVID and talk about what things look like now afterwards.
What's my process as the patient like now? What will I see and what will I go through if I have surgery?
You're going to be scheduled for your procedure. All that will be handled with your physician's office. A few days prior to your scheduled procedure, our pre-admission department is going to be calling you, going over some of those things on a phone call with you. But in addition to that, they're going to be talking to you about any exposures, symptoms, things of that nature that you may have going on with you right now so that we can make sure you're good to go. And then they're going to ask you to come into one of our drive-up stations to be tested. And that would be roughly 48 to 72 hours prior to your scheduled procedure. You come into the hospital on the day of your procedure, you'll have a temperature check, you'll get a mask, you'll check in at registration, and then you'll come up to the second floor and we'll take you from there.
What if their test comes back positive for COVID-19?
If you're one of those people that don't have the option of waiting anymore, there's a discussion that needs to happen with your physician, and we need to talk about whether or not this is something that should wait until you've been cleared from your COVID, or whether or not it's something you have to have, and we need to be prepared for that. And we can take care of you if you're COVID positive or negative.
How do you ensure that everything stays clean and sanitary?
Here in the operating room, we do a lot to keep clean. We clean between each case, we clean each surface, ceiling to floor, and it's called a terminal cleaning. We are all dressed in the same hospital provided scrub wear. We all are hatted and masked at all times, and we're very aware of our environment here, and that's our business.
So with COVID-19, was it that much different? Did you have to put in different processes and cleaning procedures?
The first thing we made sure of was that all of our cleaning agents that we were using are all virucidal, which means that the viruses are very susceptible to those cleaning agents. And we made sure that all of our cleaning agents that we were already using were going to be appropriate for COVID-19, and they are. The only major change I would say is when we're intubating a patient, which is putting that tube down their throat for breathing, and that is called an aerosolization procedure, which means some of the particles, if they were COVID positive, could be expressed into the air. We have special air handling in each OR that turns all of the air in this room over a number of times per hour. Overall, our surgical site infection rate is well below the national standard. If something's going on with you, please come see us here at Palomar. There's nothing to be afraid of. We are ready to take care of you, and we're here to serve the community.